we're expecting to find out today if the province will move Toronto and Peel regions into the grey lockdown of Ontario's pandemic restrictions as a stay-at-home order lifts on Monday. While some are eager to begin to reopen, the top doctors in both areas have requested the Ford government impose toughest restrictions. And joining me now is Dr. Lawrence Loh, Peel's Medical Officer of Health. Good morning, Dr. Loh.
Good morning. Thanks for having me.
Thanks for being here. So let's start off first with why have you requested the Ford government place Peel region under the grey lockdown zone?
Well, so we are recognizing that with the exit from the provincial stay-at-home order, we do need to continue to move cautiously. The variants in our community are continuing to go up, and we're into the situation where we're having more and more variants and still not yet a lot of vaccine. And so with warmer weather on the way and hopefully with more vaccine rolling, we'll just take a little while longer just to gradually reopen and make sure that we keep things under control.
And I do have to ask you, these variants a concern not only here in Ontario and Canada, but really around the world. And so how do you reopen safely with that in mind?
You know, that really speaks to the idea. We know that these variants are more transmissible. We've seen the experience of other countries such as the UK and Ireland, where if you move too quickly, what happens is you actually see cases and hospitalizations and deaths increase rapidly, and then you actually need to go back into a stronger lockdown. I know for many who are frustrated, especially our businesses, they're looking for certainty when they reopen. And so my goal, my definition of success is not simply just reopening. My definition of success is when we reopen, we stay open and we exit from the pandemic altogether.
And I know that you have the job of making sure that these restrictions remain consistent throughout the region. We saw Mississauga Mayor Bonnie Crombie requested her city be placed under the red control zone, even if the rest of the region remains under lockdown. Is that something Peel region is considering?
Well, I think the thing to recognize is that all three of our regional municipalities, especially in the face of variants, have seen an increase actually in our case numbers just in the past week. Our R factor is a gain above 1, which means the pandemic is growing. And we do know that variants have been detected across all three of our municipalities. So really, the need for us to maintain and remain cautious across the region is paramount.
Now, you said it yourself, we keep heading under different color-tiered systems here. So how will we know when Peel is ready to move down in the province's color tier system? Is there kind of a threshold you want to meet, or somewhere that you want to see the region when it comes to numbers?
So certainly the most critical thing I want to highlight is I, like anyone else, would love to start moving down the regional framework, but the province's framework. But, you know, it's my job to make sure that I'm recommending where we are based on the numbers. And so certainly we have testing capacity and tracing capacity that has improved, but our hospitals are still seeing occupancy that is around the level of where they were at wave 1. So we want to keep an eye on that. And we want to make sure that the cases, which ultimately become hospitalizations and deaths, is actually on a decline as opposed to the uptick that we saw this week. And finally, the last thing that we're always tracking, variants and vaccines. It's a race right now, and we want to make sure that the vaccines win that race so that we can stop this nightmare.
You mentioned vaccines. This is kind of a big hope for a lot of people in order to regain some sort of normalcy. So we have news of more vaccines arriving to Canada. Talk a little bit about Peel's decision to launch its own online vaccination booking system.
So this is really the ingenuity of our two hospital partners. We have worked very closely together with Trillium and Osler throughout the pandemic. And in looking at our allocations that were previously received, we determined that we had enough vaccine to start a limited roll for our 80 pluses. And so our hospitals went ahead. Trillium launched a pre-registration. Osler basically rejigged their online booking system to be able to get a real-time booking in place. I know Trillium's real-time booking system is going as well, and we were able to offer a limited amount of vaccine to those 80 plus to provide that level of protection in the community.
Okay, Dr. Loh, thank you so much for joining us this morning. All the best to you.
Thanks very much.
And our You Sound Off question today, should Ontario issue mandatory proof of vaccination? Give us a call, 1-866-267-3793, or email us at feedback@breakfasttelevision.ca.